So let's just go through real quick the different approaches to build our PCS code. There are 7 different approaches to choose from. And again, with our Surg, in our Surg section, that character for approach is the 5th character. Our choices are open. Examples, cutting through the skin, of course those open procedures. Abdominal hysterectomy, laparotomy would be examples of an open approach. A percutaneous approach. We have liposuction would be an example. Percutaneous paracentesis. A PTCA of a coronary artery would be an example. Percutaneous endoscopic, those endoscopic procedures, so like a laparoscopy, an arthroscopy would be an example of a percutaneous endoscopic approach. External. The external are those procedures that are performed directly on the skin or indirectly by application of external force. Those are going to be those like your closed reduction of a fracture. Resection of tonsils is also an external approach. Be a natural or artificial opening approach. That's going to be that non-visualization instrumentation. So examples would be a DNC, insertion of a Foley. If you have an endoscopic approach and be a natural or artificial opening endoscopic approach, that's where they're going to have that visualization instrument. Bronchoscopy is an example of that one. Probably an EGD would be another one. Be a natural or artificial opening with percutaneous endoscopic assistance. LAVH, a laparoscopic assisted vaginal hysterectomy, would be an example using a percutaneous endoscopic assistance approach through that natural or artificial opening. So let's kind of check here. Let's look at this scenario real quick. We have a patient that presented with an esophageal varices. An endoscopic ligation of the esophageal varices was performed using bands placed via a band ligation device. So what is the appropriate ICD-10 PCS code? We can see that our root operation is going to be occlusion. Okay, so how do we know that our root operation is occlusion? In ICD-10, ligation, which they're doing up here, the endoscopic ligation, is coded to the root operation occlusion. And then what is going to be our approach? Because they're using the through an endoscopic ligation, our approach, that 5th character, is going to be percutaneous endoscopic. So I can see my code is going to be 06L34CZ. Let's see if we wanted to pull up our code book here, our online code book, and if I went to med surgical section, now esophageal varices are the lower veins, so my body system here is going to be the lower veins, and then I know it's occlusion because the ligation codes to occlusion, and here I have my esophageal vein. It's percutaneous endoscopic because it's through the scope, and it's extra luminal device, and then there's no qualifier because I know they said right here that it was a band ligation device, so it's an extra luminal device. And then here's just the rationale that's printed in the coding clinic, the 4th quarter 2013 coding clinic, that just talks about endoscopic banding of esophageal varices involves completely occluding blood flow and meets the definition of root operation occlusion. So I think that gives a pretty good example of how you guys will want to make sure you understand those root operations and your approach. And again, during our weekly sessions that we have, our go-to meetings, we can go over more of these as you guys begin to practice more with your activities and some of the practice questions in your book.